So what we tend to do is get you back here for a blood test on day 5 to check your response. And then based on that result, we will then call you back, inform you if the dose of the Gurnal F needs to be changed. The following day, so normally about day 6 or day 7 of your medication, you need to take another drug called Cetrotide, which is this drug here. What this drug does, it stops the eggs from being released prematurely. Again, it's an injection. Unfortunately, though, you do have to mix it, so it's unlike the Gurnal F, which is pre-filled. This one you have to mix together. Again, it's subcutaneous. It's taken once daily. It is preferred to be taken in the morning, and it is preferred to be taken into the tummy. Again, similar area as you do the Gurnal F. So I tend to say when you do both injections, take them both on the same side, so both on the right side, so you have one side that you're actively using, the other side is recovering and not too sore, because otherwise if you try and do it all over your tummy, the whole tummy might feel a little bit uncomfortable. So
is the needle the same size on this one as the
it's
pen?
Slightly different, only because it's a different brand type. However, it's still a subcutaneous medication. It does look longer, and people do get concerned that it appears longer and thinking it's going to be more uncomfortable. But it's not the needle that's uncomfortable, it's more the medication. So this medication, unlike the Gurnal F, does sting a little bit, has a tendency to sting, and also has a tendency to cause like a local irritation on some people's abdomen. So some people, every time when they take this injection, will get like a red inflammation site, or some people might just get it for the first few days and then it goes away. But some people do get it every single day. It's not anything serious, it's just some component in the medication that causes that for quite a few people. And it normally goes away without any, anything that you have to do. It will normally just go away by its own accord, really. So the Cetrotide comes with a pre-filled pen that has the liquid inside, and then it has the powder, which is the medication here, and it has 2 needles that you will use to mix the medication. So you have 2 needles. The large yellow one is for mixing. So unscrew the white cover and attach the needle. Take the cap of the powder and then place the needle through the centre, then inject. And just allow a few seconds for it to dissolve. This is the stubborn one. Okay, so then you can draw it back up. So literally place the needle in, draw it back up into your syringe. Take off this needle. You're going to put the injecting needle on. So twist this off. So then you hold it upright, you flick to get rid of any air bubbles, take it off the cover. So this needle does look longer than the other one, but it's just the different brand type basically. So the purpose of taking the Cetrotide is to stop the follicles from being released prematurely. So as we know, once the follicles get to about 40 millimeters in size, you in your body develop a surge, or you can develop a surge, and therefore we've lost the follicles that we wanted to collect. So this is your control drug, and it stops
basically stopping you bleeding.
No, it's stopping you ovulating.
Okay.
So normally follicles, once they get to a certain size of maturity, the body kicks in with another hormone that makes you ovulate, and this is to stop that ovulation occurring, because we want to take you to theatre on a specific date and time and collect the eggs. Otherwise we've lost control of the whole cycle.